Are you ready to be connected? You're listening to the Insured Connection podcast by Pica Group, a pro assurance company, where we provide expert advice for your practice when you need it most. We connect you with industry leaders to discuss timely topics so you can listen, learn, and get back to caring for your patients. Now, let's connect.
Well, hello, everyone. This is your host, Dr. Adrianne Ross, and I am the host for the Insured Connection. So thank you again for joining us. We've really enjoyed bringing to you just from all different ends of the spectrum, everything from our attorneys, like I had mentioned before, to some that are not even in medicine and just their perspective and how medicine has impacted their lives. And then today we're going to do something different, which I'm really excited about, is we're going to talk to a couple who is very involved in the practice of medicine. Both are physicians, both are foot and ankle surgeons. They're married to each other, which is why we're titling this Marriage in Medicine, and really pull back the curtain and allow them to be vulnerable and share with you kind of how they do it all, since both of them are so heavily involved. So I'm going to go ahead and introduce Christy and Mher. And if you could just tell us a little bit about yourself and what you're doing right now. And Christy, I'm going to go ahead and start with you first, or Dr. King, go ahead.
Absolutely. Well, thank you for having us. We graduated, I guess, over 15 years now, and I practice at Kaiser Oakland in the San Francisco Bay Area. I'm an attending there, as well as I'm the residency director, and I've been the residency director for now 12 years. So I really enjoy education, and I take that into educating my patients, as well as when I work with our residents, and then educate on a national scale. So I enjoy extracurricularly working with the AO Foundation with our advanced and basic AO courses, as well as the ACVAS arthroscopy course. So that's more of my ancillary activities that I do outside of the residency program and patient care.
Wonderful. And Mher, Dr. Vartivarian.
Yeah, thanks for
Tell
having
us
us.
a little bit more about you.
Well, absolutely. As Christy said, graduated 16 plus years ago now.
I'm the woman. I figured we estimate a little bit on the younger side, but leave it up to him to stick with the facts.
I wasn't going to say anything.
Facts and overstating. Yeah, so I joined a private practice immediately after graduating residency, and now I'm one of the regional chief medical officers for Balance Health. We have a big practice going on. I'm the associate residency director for the last probably 8 years at the St. Mary's program. Clinical instructor at St. Mary's and UCSF now, I guess you can say. Clinical instructor at UCSF. I'm an associate professor at Samuel Merritt University, the Podiatry College there. So I get clinical third and fourth year students. And the chair of the podiatry department at a Sutter facility. So, a little bit of everything.
I mean, you two are real underachievers, really. I mean, you can just hear it. And so, in addition to that, I mean, the two of you have been involved with the Western Conference. You've been involved in, basically residency enclaves on the West Coast. I mean, there's a lot that you're not saying that, I'm sure we can keep going on, but tell us a little bit about, one, your family life, and do you have children? Tell us a little bit about the family.
We have two lovely children. One of them is, she just turned 9-year-old little girl. And then we have a 2-year-old little boy who is on my lap now, who can't leave my side, which is a blessing and a curse probably at the same time. But we're very lucky to have a beautiful family. And we live in kind of the suburbs of the Bay Area, so we're able to enjoy a lot of the outdoors. Part of the reason we kind of picked this as our background for today. But do you have anything else to say about?
Yeah, I mean, we try to, prioritize family as much as we can. Yeah. Of course, everyone wishes they could see family a lot more and be around a lot more, but, you have to be able to support them too and grow as a professional as well. So we try to kind of prioritize everything all at once and give everything we have to our children, our families, our profession. And
And, you know, a lot of times it comes up as this idea of like balance is almost if they're competing factors. And throughout our own jobs, as well as working with the residents and their families, we find it really brings us more joy to try and spend it together. So many times, you know, we'll be hanging out with the residents' families and getting to know their kids and their wives and their significant others. And so we try and, even when we're working, we try and share that with our family, which is important, I think, to kind of bring that balance together.
It's funny that you say that because I, I feel like a lot of times we do have a tendency to section off certain parts of our lives, and we can't necessarily always bring our whole selves, but just seeing the two of you, I've seen the two of you individually and then also seeing the two of you together, at your craft and then also as parents and also as spouses, you bring your whole self, it seems. So, so Mher, I'll ask you for one, how do you find time to be with this woman outside of work? And, do you do the same thing? You kind of allow it to overlap, or date nights? How do you guys do this, especially with two small children?
Yeah, luckily our children have been so far very good. So we actually enjoy bringing them with us everywhere. We're going to have our first no children trip here in the next month and a half ever. So it's
Wow.
going to be a little interesting and maybe stressful. I don't know.
Probably
You know?
good, probably good for us,
Yeah.
but
Probably good.
Yeah.
but yeah.
No, but like I said, we like to prioritize family. So, we try not to talk work at home. That's a big thing because we have work going on all day, every day. So we try not to
Yeah.
talk work at home if we can avoid it, which we typically do. And um, I mean, luckily our kids like doing everything we like doing. So if we want to go to a sporting event or a concert, they'll come with us. If and
Like what you're hearing? Go ahead and subscribe so you never miss an episode again. Now, let's continue to connect on today's topic.
Oh, that's great.
yeah, and we also have the fortune of having family close by now. So if like it was just Christy's birthday, so we got to go out on a date night and leave the kids with grandma. So to find
Yeah.
those little instances where we can do things like that because that's still important.
Absolutely. Christy, how do you find time to support Maher, and just even him growing professionally? I mean, both of you are doing a lot. It would be one thing if one of you were, chair of departments and the other one kind of just, maybe spent a little bit more time at home. But the two of you are, I hate to use the term gunners, but I mean, the two of you are quite involved.
Yeah, I mean, we're definitely busy in different ways. I think we try and take advantage of even just like little moments. I know we text each other throughout the day many times. You know, if we haven't heard from each other by noon, it's kind of like, oh, how's your day going? Or how is it things going? So I think even just those little moments are important to check in with each other and just let each of us know that we're thinking about the other person, even on a normal day. And then, you know, we have our times at home when the kids are busy playing ball in the play area, or, you know, where we try and talk a little bit and see how each other's days went. And we don't talk about work commonly, but I find that we do feel a lot of just safety in, you know, running complicated cases by each other or just getting each other's opinion about certain things. You know, I don't feel like there's any competition there. If anything, it's just a way to kind of help solidify, you know, why we chose what we did or what we're doing. Or we do have slightly different practices. So I have a little bit more of a sports trauma, still typical podiatry stuff, but a little bit more heavy on that side of it. And he does some of the trauma, but a lot more wound care than I do. And having worked for Kaiser Permanente versus private practice, I have a lot different wound care options than others. So I know I definitely pick his brain when it comes to complicated wounds that we don't see as much in my practice. So
Wow, that was actually going to be my next question. The two of you practice, like you said, almost in different niches, so to speak, and so how that complements one another, and do you bounce ideas off each other? So you just jumped right into that. I am curious because you have two children. Do you have hopes of them going into medicine, or what are your plans for them, or what are your thoughts about them?
If they could be YouTubers early, no, I'm kidding.
I was going to say that's where everything's going now.
Right. No, I mean, we're there to support them with whatever they want to do, whatever they enjoy.
Yeah.
It's going to change throughout the years. My daughter one day wants to be a makeup artist, another day wants to be a basketball player, another day wants to be a veterinarian.
Yeah.
We'll
I love the options.
right. We'll support them fully on whatever they want to do. We don't want to push them towards anything,
Yeah.
because you really have to enjoy what you're doing. Like that's what anything that I've done in the past that I was forced to, I never want to do again. So
Yeah.
we just kind of want to let them, guide, and we'll be there to support and advise. But you got to enjoy what you do.
I know.
Oh,
He
buddy.
just saw Sissy through the window, so
Oh, he's giving us his opinion too on his
Yeah.
future career role. Yeah.
that's right.
Yeah, I completely get that.
This one might be.
Yeah.
He loves any. Well, our first kid was a girl, and she was very calm, very composed. I don't know if it's second kid or boy or what it
It
is, but
is.
he loves balls. He loves jumping off of anything. So most of our life now with him is just trying to keep him from killing himself or hurting himself.
Suicide watch.
Yes.
Yes.
So that's
My
been
second is the
entertaining.
same.
Yep.
Yeah, I didn't really believe the myth of the second child, but I am 100% a believer now.
Totally.
Absolutely.
100%.
Our little guy's a lefty too, so he's got a pretty good arm as a lefty, and following in his sister footsteps, she loves basketball,
Yeah.
so he's already got a good lefty shot. So we'll
Yeah.
see where that takes us.
Wow, I like that. I've got a lefty too.
Nice.
Yeah, my son's a lefty.
Sweet.
Wow. Okay, so I do have a question. This is a question that comes up all the time. And students that are dating each other, residents that are dating each other, young attendings, like it happens all the time. They always ask me this. They said, when do you recommend getting married? And when do you recommend having a child? This every single time always comes up. Do you two have any thoughts on that?
Oh boy, that's a tough question.
That's what I thought. I was like,
There's
there's
no
not really
right
a one size fits all. Yeah.
Yeah, no, for us, we waited until we graduated residency. As any broke resident comes out, we didn't have a honeymoon for at least a year after. And then, you want to grow your career. So we didn't have a child for 5 years, 6 years,
4 years.
Yep.
something like that.
We got married in 13, and we had our kid in 16. Not even 3 years.
Oh, 3 years.
Right?
3
4
years.
years after residency.
Yeah, I'm pretty sure that's it. It's been a long time
It's
now.
a blur.
but
I
Yeah.
was gonna say.
Yeah. So we were able to, get our career going and get into the positions we're in, and then started a family. And then you can see there's a huge gap between the two. So focusing
Yeah.
on one kid while still building a practice and working, and I guess you'll know when it's the right time. You just have that
Very nice.
feel.
Mhm.
But there's not a one size fits all from what I feel.
Yeah. I mean, I would agree with that. And for us, that's what worked well. We grew up in reasonably, I can't call it low income, but middle income family, sometimes single parent family, and it was really important to us to be able to pay for our own wedding. So that's part of why we kind of wanted to work for a year to build up that income to pay for our wedding
Yeah.
ourselves. And so that's why we waited just a little while. And then kids, kind of the same thing for me was to some degree waiting to get my boards. So I kind of wanted to just build my cases so that we had that stability of my career and then partnership within the system, and then could dedicate more of my time, to my family and not have to worry about job security or anything like that. But
Yeah.
waiting also comes with a cost as an older female. So, I mean, I think that's always something to think about that is very rarely talked about within, especially, older professionals, medical professionals that dedicate a lot of their early life to school. So
Yep. Yeah. I think that was the impetus for a lot of the questions that keep happening. It's, should I do it early, or should I wait?
right.
So that comes up. The other question that I've been asked a decent amount is, for mostly for students or for those that are dating, they'll say, well, what's the benefit to dating somebody in medicine opposed to somebody who's out of medicine? Because in medicine, can I ever escape work? And then if I'm dating somebody out of medicine, will they never really be able to relate to me? And so I'm curious what your thoughts are and how it's worked for the two of you.
I walked into life in medical school, I guess you can say, saying I would never marry anyone in medicine. But then, but then, but then, once you hit it off, you hit it off. It doesn't matter who it is, and as long as you guys love one another and get along, and complement each other, that's all you need. So I wouldn't discourage or encourage either way.
Want to receive a monthly newsletter with topics from the Insured Connection? Head over to picagroup.com/Insured Connection and join our email list to have it delivered right to your inbox.
I'm very happy with how everything went. So,
Yeah, it's kind of about finding that balance, and I think you can find the balance on each side. And we have lots of friends that have found balance with either fellow podiatrists or fellow medical professionals, and those that have significant others in the gas industry or the law industry, or lots of different ways. I think as long as the basis of that relationship is support and understanding, it'll succeed. And it can fail if that relationship is competitive or there's egos associated with it, whether they're in medicine or they're not. So it's nice for us because I think we understand each other's complicated schedules and just some of the complexities that even just podiatry, not even medicine alone, presents. And I feel like we're all very busy, but reasonably humble in our experiences. And so having that support is one of our strengths and not necessarily one of our weaknesses, which is
I feel like as a true test, like if you can make it through medical school and residency and you're still together, I mean, that's a pretty firm bond.
That's a pretty good litmus test.
Right. Right.
Yeah, I would tend to agree with that.
Right.
Yeah, it's funny because which I love this. I love that my little guy is actually here as well. It's because I think sometimes and for anybody who knows you, and you two actually are pretty well known, but certain couples that are within the profession, students and residents look to see, okay, how are they doing it? And I think what you two have done very well, if I can compliment you two, is that you share your family, you welcome them into the experience. I've seen you do the same thing with your residents and with your colleagues, and it's just one big family, and you two still have the ability to be very gracious to one another and very vulnerable, which I think is something very difficult in medicine, just with patients. So my last question I'll ask is, how do you show up for your patients? Because just knowing the two of you give so much of yourselves to each other and to your family and to your residents. How are you doing that for your patients as well?
Yeah, I mean, same type of thing. You want to treat them like family. You want to, I have patients from 14, 15 years ago that are still coming, and I see their kids and their mothers and their grandmothers and things like that. You want to still treat them like family. Because if I was a patient, I want to be treated as if I would treat, my brother, my sister, my wife, or anything like that. So people are coming to us in a vulnerable state. They're not coming just for fun. I always tell the patients, like, I know you're not coming here for fun. That's just a side effect of the visit. So it's you want to make them comfortable because it's already a vulnerable state. You might be injecting them. You might have to operate on them, and it's
Exactly.
you want to grow a relationship with someone like that.
Yeah,
Well
I mean, I
said.
think that's the really important part is relationships in general just take up a bunch of different flavors, whether it's partner relationships, kid relationships, resident relationships, and patient relationships. And I think authenticity is very big for both of us too. It's very hard for both of us to lie in general. Like we have a really hard time with that. So we live, I think, a lot by just authenticity because then I don't have to be anxious or nervous about how I've treated somebody if I'm always authentic and treating them as if they're my own patient or they're my own family. I can always stand by that. And so, yeah,
Someone's hungry.
yeah, he's hungry. Time to eat, and he's making us some ice cream while we're waiting.
Oh.
So that's fun. But yeah, I think we take our relationships don't differ very much when it comes to cross friendships or relationships or patient relationships. I think we carry that through all of those relationships, and that's almost easier for us to always be that person,
Yeah.
and kind of carry that into all of those experiences.
Yeah. Gosh. Guys, I'm not going to keep you much longer, but I did want to say just for all of our listeners out there, for one, we're trying to also paint the picture of an authentic picture of who the physicians are, not just to the general public, but also to one another. And to be able to be vulnerable with one another. And you two really, really just encapsulate that. So thank you so much for taking your time. Please go get something to eat for my little guy,
Do you want to say hello?
And thank you just for being such great leaders, and just sharing the time with us. Hi, buddy.
No,
So I'm going to let you go get him something to eat. But to both of you, Dr. King, Dr. Vartivarian, thank you so, so much.
thank you so much for
Thank you.
having us. Good seeing you.
Yeah, great seeing you. We
Absolutely.
look forward to seeing you in person soon.
Likewise. Have a good evening.
Thank you, you too.
And that's it for this week's episode. But let's continue connecting. If you're enjoying the Insured Connection, don't forget to leave a review on your streaming platform and subscribe now so you can connect with us each time we post a new episode. To stay connected with us throughout the week and to tell us topics we should discuss on future episodes, go to picagroup.com/Insured Connection.